You know, finding health care can be a daunting task for almost anybody, but imagine finding health care for people who have just arrived in this country. Language, of course, can be a barrier, so can finances, not to mention a lack of support. A new clinic has now opened in Burnaby. It's trying to change all of that. It's called the Global Family Care Clinic, and it's established to benefit the area's newcomers. Kimberley Reid is a nurse practitioner who leads the clinic and joins us here in Studio 10. Kimberley, good morning and welcome.
Good morning. Thank you for having me.
Tell me about your new clinic and what services it offers.
Yeah, so Global Family Care Clinic recently opened, and so we're serving newcomers to Canada that currently don't have a family doctor and who have been in Canada for less than 3 years. And so the clinic was established as a innovative joint partnership between the Burnaby Division of Family Practice and Fraser Health. And so the clinic is run by myself as the main care provider as a nurse practitioner. And so we work with local health, social service, and settlement agencies that identify individuals and families that might benefit from our clinic.
Okay, so apart from the health care, what else does the clinic provide?
Really, it's more holistic healthcare. So where people are at, especially as newcomers, as you mentioned, language is a big issue, and also just settling into their new community. And so really it's meeting the person and the family where they're at. So oftentimes you're dealing with concerns about housing, about income, about all these other things that aren't health concerns but have a huge impact on their health.
So this is why it's classified as a transition clinic, because they're transitioning from one life to their new life.
For sure, yeah. And so the clinic will see people for 18 to 24 months, and then when they're ready, we'll offer help to help them to find a family doctor in their community.
What are the biggest challenges the patients who come to you suffer?
I think that really a big part of it is navigating the healthcare system. And so sometimes we take it for granted with, being able to make an appointment, being able to make it to that appointment on time, being able to communicate your concerns to the healthcare provider. And oftentimes that, even just those simple basic things, can be a huge challenge.
You mentioned that language can be a barrier. What if someone comes through your door who can't speak a lick of English? How do you deal with them?
Yeah, so the clinic, one of the great benefits of the clinic is we're able to offer interpreters. And so through Fraser Health, we work with Provincial Language Services, and we try to book in-person interpreters for those health visits. And so in that case, the clinic isn't a walk-in clinic, but we always book appointments because we try to have interpreters available. And if not in person, then we do use telephone interpretation. And that is huge for people to be able to communicate with us.
Now, you've located the clinic in the Highgate neighborhood of Burnaby. Why did you choose that location?
That location, the clinic is co-located with the Burnaby New Canadian Clinic, which serves government-assisted refugees. And so that was part of it. But also the clinic, that Highgate area, is very culturally diverse and does have more affordable housing in that area. And so there are lots of new immigrants and refugees that are settling in that area. And so I would say that starting off, it's a small population right now, but so much of our population is almost within a 5-mile radius of the clinic.
How busy is the clinic? How many people would you see in a day?
It has been a lot. It has been more busy since our open house on November 1st, so we are getting a lot more referrals in. We would typically be looking at seeing about 8 appointments a day.
And how many staff members do you have?
We have, there's myself that's there Monday to Friday, 8:30 to 4:30.
Right.
I have an office assistant, and then we have collaborating physicians that come in once every second week as well.
Whose idea was this?
This was actually, it was a joint proposal through the Burnaby Division of Family Practice and Fraser Health. And through the Nurse Practitioner for BC initiative through Ministry of Health, there was applications that were submitted from across Fraser Health and across the province. And most applications are looking at vulnerable populations and increasing access to care for people. And so luckily this was one of the applications that was approved.
You're still in your infancy. You've only been open for just a little more than 5 weeks now. But based on what you've seen, do you feel, Kimberley, this is an economical way to provide health care and also social services?
I really do. I think that if we are able to provide that enhanced service at the beginning when families are settling into their new communities and really helping them to figure out how the healthcare system works, I think we can make better use of our healthcare dollars. We can really provide health promotion and prevention, and oftentimes that's things that as new immigrants and refugees coming from the countries that they've come from, those aren't ideas that are often seen. And then also educating them on when is it appropriate to seek emergency services and go to the ER.
Do you see clinics like this expanding now across BC?
I certainly hope so.
Have you had any interest from other communities so far?
Not yet, but we've really worked hard to document the process of starting up this clinic and to really be, if possible and if needed, a resource for other communities in starting up this clinic.
With so many new people coming to live in this country, in this province in particular, it sounds like a wonderful initiative to get them on the right track from day one.
Yeah, I'm really excited about this clinic and the opportunities it can provide for our community.
Kimberley, best of luck with it.
Thank you so much for having me.
We'll continue to keep in touch and follow, see how you do.
Thank you.
Kimberley Reid, who leads the Global Family Care Clinic in Burnaby. Now your turn to speak up. And what do you think about this health clinic to meet the specific needs of refugees and immigrants, new Canadians, new people who come to our community who may not speak a word of English but do need health care? Health care plus social services, all in one spot. Let us know.